I'm Dr. Carrie. Super great news. A couple little puppies came in and they were from a breeder, and I guess they were sick when they got them, and the owners didn't really want them and wanted to euthanize. And then when we said, hey, there's another option if you're not into these puppies, we can definitely take them off your hands. And they were super pumped to hear about that, and we were super pumped to save their life because euthanasia should be the last option. So thanks to y'all's donations, we got a little bump in donations from you guys, and please spread the word and keep them coming. But we were able to rescue 2 adorable puppies, and they're currently in treatment for parvo. So let's get started. Results on the boy dog. His white blood cells are normal, so especially we look at the neutrophils because that is an indicator of the severity of disease. So either it's early in the disease or he's not as affected as sister, which does go along with the clinical signs that we're seeing. Slightly anemic from bloody stools, and they have hookworms, low protein from hookworms and diarrhea, and that correlates with the low albumin, which is a protein. Sister, on the other hand, has lower neutrophils, so lower than normal. So she's losing white blood cells into her GI tract, which correlate with the fact that she is more clinically affected. But protein and albumin are about the same as far as being low from hookworms and diarrhea and not eating. So anyway, looking at the blood work, it definitely makes sense that she's more affected than him. However, we may just be early in his disease. So time to get them all hooked up to fluids, antibiotics, and let's just see how things unravel in the days to come.
I know. Look at the camera. Say hi to Sarah. You feel better, yeah. Yeah.
Archie. Look, 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 look. Oh, boy. Oh, best boy. Oh, I need plasma with my face. I have that face.
See all your other stuff first.
I love you.
Yeah, they're
I love you.
cuties. Yeah,
Parvo's
they're
not
cuties.
transmitted through puppies.
Vaccinated.
Sydney, calm down. Sydney's looking good this morning. Pulled her catheter. She is doing great. Unfortunately, Billy here has a little swollen face. He's not doing quite as well. That's okay. We're about to start some plasma and continue treatment. He's actually in better spirits now that I started my update than before. But resting comfortably. These are some lucky dogs. And we're about to move in with the plasma.
Did you eat all of your foods? Uh-oh, we're vaccinating today. We're getting some weights on you and some pictures. It's been 2 weeks that you guys have been here, actually. You can probably come into Gen Pop. How exciting is that?
Okay, Sydney, let's see how much she weighs. It's gotta be more. Oh, 16.6, not much more. And then we're gonna do a skin scraping on the hair loss because both of them have that, and they've kind of had it since they first came in, but it's been not a real concern. First concern was saving your life, right? Oh gosh.
Precious babies.
Yeah, about 16. It had that. Scrape it and look for Demodex. Well, it's what we suspected, Demodex mites on Sydney and Billy. You can see their little legs moving, and they're shaped like that long caterpillar cigar because they live down in the hair follicles. And what I was mentioning was that they probably have Demodex because they have a lowered immune system, having parvo, having intestinal parasites. So we should be able to treat that with their monthly Simparica Trio. If we need to add other medications, we will. Oh my goodness! It's growing up. You're gonna have puppy friends? You're gonna have real friends. It's gonna be real dogs now. I know. It's okay. We'll get a little room set up and get them in the big cage. Oh my goodness.
Wait! Wait! Basset puppy's crazy! Sydney! Hi! Hi! What are you guys doing? Gonna be friends? Gonna be friends? Do you guys even care? I gave you new friends. Nope, don't care. Okay. I had this plan. You guys were all just gonna be besties. You don't even care.
On a scale of 1 to dramatic, what is she gonna be about this hernia injection?
Dramatic.
Plus, plus, plus.
Poor baby.
She's already being dramatic.
Oh,
Ryan, go. Okay.
oh, honey.
That'll make you feel better. It's okay.
You gotta get better.
You better get better.
shape up so you can ship out, sister. Oh no. Look at her.
Oh no.
Bitches. Given her an hour after her anti-nausea medications and she's not eating. That is highly abnormal. Way to go. What happened? Sydney! Well, she's feeling better, she's eating better, she's not vomiting, but check out the explosion April came into this morning.
Yuck.
Yeah, so if you really want a real deal of what it's like to be a veterinary technician, you gotta be okay with poop like that. I'm okay with poop like that in animals. I am not okay with poop like that in people. Oh my gosh, I would just throw up and pass out and die. Anyway, now we're gonna start medication for the diarrhea. I'm glad she's feeling better, but she has an adopter, and I don't know about you, but it would be a little concerning if I just saw what happened in that video the first day I got a dog home. So, anywho, Sydney's radiographs, just making sure that she didn't eat, anything obvious since she is a puppy. Looks like she ate a little bit of her kibble since vomiting overnight, so that's good. And nothing, that really stands out to me as an emergency or a reason for surgery. So we're just going to wait and see, treat her symptomatically, and hope that she gets better. What'd she weigh? She looks better. Sydney! You gotta go to your home tomorrow, so you need to quit.
What do you want to play for?
Yeah. All right. Good job!
You went to the bed so you could go home?
Guys, we are first hopefully telling Billy goodbye because his adopter brought their dog today to meet him. He's already passed meeting the family, so fingers crossed. And then I think Sydney's going to be going home this afternoon too. So we just want to tell them bye, tell you guys thanks for all your support, for your donations, for everything you do to help us out. And we'll see you on the next one. Say bye, guys! Bye! Bye-bye, baby. We love you. We love you.